1, 2, 3, 4, 5, 6.
A cardiac arrest occurs once every 90 seconds in the United States. Roughly 1,000 events a day, roughly 360,000 times a year in the United States. The real key is the no-no. No, not conscious. No, not breathing normally. That is a cardiac arrest until proven otherwise. So what do you do as a bystander if you come upon someone who's collapsed in front of you? And the first thing I want to know is, are they waking up or did they just have a fall? So I'll say, sir, ma'am, would you wake up? If they're not awake, next move is you call 911. Make sure the operator knows they can get dispatch going and getting paramedics on scene. They will ask two questions. Is the patient conscious? Patient is not conscious. Are they breathing normally? Patient's not breathing normally. That is a cardiac arrest till proven otherwise. Typically, they'll say, put your phone on speaker. They'll give instructions in CPR. You put one hand in the middle of the chest, between the nipples, one hand on top of it, and this is hard work. You're going to have to press it about 100 compressions per minute and as hard as you can with each compression, making sure that the pump, the chest, is getting the blood out. 1 and 2 and 3 and 4 and 1 and 2 and 3 and 4 and 1 and 2 and 3 and 4 and 1 and 2 and 3 and 4. And you keep doing that, pressing as hard as you can, and about 100 compressions per minute. That 1 and 2 and 3 and 4, the cadence of that is getting that number of compressions in by that way of counting. And you do that without interruption until the emergency medical services, paramedics arrive, and they can take over care.
Evaluating heart rhythm. Stand by. Preparing to shock. Everyone clear. Press flashing button. Shock delivered.
If someone has a cardiac arrest, one of the things when you call 911, the operator or dispatcher will ask is there a defibrillator in the vicinity? So for example, if you're in a public building, there may be a defibrillator available. You turn on the device, and the device then instructs you exactly what to do. If you can combine citizen CPR with what's called a public defibrillator, a public access defibrillator, you have an even higher chance of that patient surviving, because now you're providing treatment within the first 5 minutes, whereas even the best arrival time by paramedics may be 7 or 8 minutes or even longer, depending on where you might be.